Hi, I'm Mayor Frank Jackson. You've probably seen media coverage of the growing opioid epidemic in northeastern Ohio. But what you might not know is how many of these tragedies begin with a seemingly innocent prescription for pain medication. That is why we're teaming with the Cuyahoga County Opiate Marketing Task Force to encourage you to know the risk. Go to the website on your screen to learn which pills are opiates and alternative ways of dealing with pain. Which starts as a prescription can end with addiction, so know the risk.
Welcome to Healthy Cleveland. I'm your host, Leah Haslage, and today's topic is on immunizations, specifically with your child. Our guest today is Annette, who is a public health nurse with the Cleveland Department of Public Health. Welcome, Annette.
Thank you, Leah. I appreciate being here with you today.
So start off by telling us what your role is in the department.
Well, as a registered nurse and also as a public health nurse with the Cleveland Department of Public Health, parents, as they bring their children to our immunization clinics, I have the opportunity to talk with parents and also review the child's immunization record. After looking at their immunization record and assessing what vaccines they may need, I determine which vaccines would be necessary for them.
Now, when a parent comes to these clinics, what can they expect?
Usually when we have parents bringing their children to the clinics, you can expect that we will take time to look at their immunization records. And again, a lot of our practice at the Board of Health really relies on a lot of schedules from the Center for Disease Control. Basically, that is where we get our information as far as what vaccines are needed and at what ages. So I rely a lot on different schedules to look at what immunizations are necessary. Sometimes we'll have parents come in and they don't have an immunization record. They may have moved, or they may have lost their record, or their doctor's office may have closed and they have no record. So a big asset that we have in Ohio now is something called Impact SIS, and it's a program where a lot of the doctors are putting in immunizations into this system where we can access that on our computers, so we're able to look up a child's immunization record and see what immunizations are needed for that child.
Because they're probably constantly changing the immunizations that are needed, right?
Well, you know, not really. There are new vaccines that are sometimes added, and we could talk about that a little later, mostly for adolescents. But for children, for infants and children, the vaccines have been pretty steady for a while. You know, there have been some that have been added on. Basically, vaccines protect infants and children against 10 most common diseases.
Yeah, what are just some of the common ones?
Well, first of all, the hepatitis B vaccine is a vaccine that is given to infants usually within 24 hours after they're born. So that vaccine, hepatitis B, is given initially in hospitals. So when children come to us, the minimum age that we can give vaccines is 6 weeks. It's recommended that they start vaccines at 2 months, but actually if the mom brings the baby in at 6 weeks, they can be given, you know, that vaccine. The other diseases that children are protected against are diphtheria, tetanus, and pertussis. That vaccine is actually sometimes a combination vaccine. The other disease is polio. Children want to be protected against polio. The other diseases include a disease called Haemophilus influenza B, and there is a vaccine, it's called HIB, it's abbreviated, HIB. That vaccine is given to children to protect them against a disease which can cause bacterial meningitis in children. So that's another real important vaccine. The last one we give to children and infants is a vaccine called Prevnar, and this protects them against pneumococcal disease or pneumonia. So those are the major vaccines that are given usually within the first year of life.
So it's a hot topic right now with immunizations. You know, there's a lot of people that think you shouldn't immunize your child, but what are the reasons you should?
Well, the main reason is that vaccines prevent disease. That's pretty much the bottom line. Vaccines prevent disease. They're really very safe, they're effective. There are cases where parents have not immunized their children. Case in point is recently in Minnesota, there have been a group of Somali immigrant parents who have refused to administer what's called the measles, mumps, and rubella vaccine to their children. This vaccine, the measles, mumps, and rubella, or it's also known as MMR, is usually given to children at 1 year of age and at 4 to 5 years of age. So this group of parents decided that they did not want to immunize their children for fear of autism. You may have heard about some relation between the MMR vaccine and autism, and there has been no proof that there's a causal effect between the vaccine and autism. However, the immigrants were afraid of the vaccine and so decided not to immunize. Unfortunately, there have been over 70 cases of measles reported in Minnesota. This has been since April, and the last I looked at their website, Minnesota Health Department's website, there were still some cases being reported of measles.
So yes, with the whole anti-vax movement, we've been seeing more measles. Polio is making a comeback.
Polio is also making a comeback. There are 3 countries, Pakistan, Afghanistan, I think, and Nigeria, are 3 countries where polio has not been eradicated. So again, you know, there is a risk still, you know what I mean, that if we don't immunize against polio, that there could be an outbreak, you know, not imminent in the United States, but again, it's important to still vaccinate against polio.
Especially with people traveling.
Exactly.
That's the easiest way to carry diseases.
It is, definitely.
Now the flu shot, is it something that you can also get in conjunction with getting your child immunized with all the other vaccines?
Definitely. Again, I've been immunizing children for over 8 years. I worked at another health department prior to working for the Cleveland Health Department. So again, in my practice and in my research, you know, the common thread is that you can never actually give too many vaccines. We prefer to give as many vaccines as the child needs, depending on their shot record. And also the flu vaccine can be given with other vaccines, definitely.
Are there any cases where a child shouldn't get a vaccine?
You know, yes, there are some what we call contraindications. The main one would be if they've ever had a severe reaction to a vaccine, which is called anaphylaxis, where they would have, you know, difficulty breathing or bad reaction. That's extremely rare. In the research is less than 1% where there's been an anaphylactic reaction. However, if a child has a high fever, very congested nasal respiratory congestion, they should really wait, you know, before they get vaccinated. Sometimes children, the most common side effects from vaccines are sometimes a sore arm, sometimes a low-grade fever. And that's about it. But really, again, if they have a high fever, then you would want to bring them back another time. For the adolescents, there are vaccines that I'd like to talk about. The first one is, the vaccine is called Menactra, and that protects teenagers against meningitis, bacterial meningitis. The Ohio law now requires 7th graders and 12th graders must have this vaccine. So again, that's the Menactra vaccine. The other vaccine is the HPV. HPV stands for human papilloma virus. And again, that's the name of the virus that can cause cancer. And the vaccine itself is called the HPV vaccine. This vaccine actually can be given to children, boys and girls as young as age 9, up to age 26. So again, it's a very important vaccine that protects boys and girls against cancer, and moms and dads should really talk to their pediatricians or their healthcare providers about getting that vaccine.
What is it about that age group that these vaccines are pretty crucial?
Well, again, the meningitis vaccine or the Menactra, again, that is more, it's there, again, the research shows that that is a disease that actually is more common at that age group. The meningitis, the bacteria actually is spread through contact through saliva. So if you're sharing a water bottle with someone, or if you're sharing chapstick with someone, that bacteria can spread from one person to the other. So again, with children going into college, you know, being in crowded conditions, if a child is living in a home where people are smoking, that's another risk factor, you know, for the child to be exposed to the bacteria. The HPV, again, that's a vaccine where the HPV virus is spread even through casual sexual contact. So again, we see teens becoming more active, sexually active at that time. That's why we recommend, you know, those two vaccines.
So where can parents take their child to be immunized?
You know, we really do try to encourage parents to go to their medical home, you know, because of the fact that children do need, in addition to immunizations, they also need regular checkups, you know. So at our clinics, actually, we do offer immunizations. We have two clinics. One clinic is the McCafferty Health Center. It's the address is 4242 Lorraine Avenue in Cleveland. And our clinics there, actually, we have a clinic there every Monday from 8 to 11. We have two evening clinics there on the second and fourth Thursday. And then on Wednesdays, we're there the first, second, and fourth Wednesday. The other clinic that we have is at the J. Glenn Smith Health Center, and that is on, the address is 11100 St. Clair Avenue. And again, we're there every Thursday morning. And again, the hours there, you can actually go to our website. It's www.clevelandhealth.org. And you can see our immunization schedule, when we'll be there, you know, for immunizations.
So do you need to make an appointment at the clinics? Or?
No, actually, Leah, you can just walk in. You know, we do not take appointments. Actually, when you come in, the most important thing to bring is your child's immunization record. If the children that come to our clinics, actually, we do see children that have no insurance. That's the most important thing. We have a lot of parents that may have just moved to Cleveland from another city. They have not gotten insurance yet, and a healthcare provider may not see them. So that's why we are available, you know, for parents that don't have insurance or who are underinsured, so their insurance may not cover vaccines, or if they're on Medicaid also. You know what I mean? We see the only children that we do not see are children that have private insurance. They would have to go to their own provider for immunizations.
And all they need to bring is their vaccine chart? Or?
Their vaccine record. If they have Medicaid, they should bring their Medicaid card. They should bring an ID, you know, their own, you know, if the parent's bringing them. In cases where an aunt or an uncle may have custody of a child, if they have any guardianship papers, you know, that would be good, but it's not always required, you know, that they bring that along.
Now, obviously, it's important for adults to get the flu shot, but are there any
Yes.
vaccines that adults should be considering?
You know, adults, there are definitely vaccines for adults. The one common vaccine that we're encouraging parents to get, and parents of newborn children, is something called the Tdap vaccine. That's those initials stand for tetanus, diphtheria, and pertussis. Small infants especially aren't protected against pertussis probably till they're about 6 months old. So it's called Tdap, and it's capital TDAP, and that's a vaccine that adults can get. Also, there's a vaccine called Zostavax vaccine that protects against the shingles disease. So that's another one that's real important for adults.
Anything else you think the viewers should know about immunizations?
I think I just would like to say that they're very important, they're effective, they're safe, and that vaccines actually can prevent illness in children. at a youth summit here in Cleveland just a short time ago, and I had a parent come up to me, and she had a child who was about 7 years old, and the mom had told me that the child had never been vaccinated, had never gotten any vaccines at all. And when I told the mom, the story about the children in Minnesota that had gotten the measles and were hospitalized and were very sick. The mom looked she had this look in her eye like, you know what, maybe I should really immunize my child. And it was kind of a glimmer of hope that I was able to talk to this mom, you know, that vaccines are important. They can prevent disease. They can prevent your child from dying, you know. And as a mom of 3 children, you know, I actually, you know, my children have been immunized, and it's important for their health and for your safety, knowing that you're doing the best you can, you know, for your child.
Well, thank you so much for all this great information. And where else can our viewers get additional information?
Again, our website, clevelandhealth.org, is a good place to look. There's also a website called immunize.org that parents can access a lot of information about vaccines and vaccine schedules too.
Great. Thank you so much, Annette, for being
You're
with us here at
welcome,
Healthy
Leah.
Cleveland. We've learned so much today, and thank you for tuning in, and I'll see you next time on Healthy Cleveland.